Peripheral arterial disease. Peripheral arterial disease. It is the narrowing of the peripheral arteries. Peripheral arterial disease is commonly caused by atherosclerosis and it usually affects the aortoiliac and infrainguinal arteries. Peripheral arterial disease mostly affects the lower limb than the upper limb due to the great muscle bulk and the poor anastomotic network in the lower limb. Patients with PAD develop ischemia due to the occlusion of the arteries. Risk factors of PAD: smoking, diabetes mellitus, hypercholesterolemia, hypertension, thrombophilia, age, greater than 70 years. Causes for intermittent claudication: atherosclerosis, thrombosis, thromboembolism, trauma, thromboangiitis obliterans, Berger's disease, vasculitis, Takayasu disease, entrapment syndromes, popliteal entrapment, fibron atherosclerosis. Risk factors: modifiable, smoking, diabetes mellitus, hypertension, dyslipidemia, obesity, lack of exercise, non-modifiable, age, sex, male greater than female, genetic factors. Thrombosis, rupture of atheromatous plaque, trauma, penetrating, blunt, iatrogenic, arterial puncture. Leads to acute ischemia, acute on chronic ischemia, thromboembolism. Sources: heart, post-me, cardiac aneurysm, AF, aorta, aortic aneurysm, atherosclerosis. Leads to acute limb ischemia. Acute limb ischemia. The leg is often affected with pain, parasthesia/paralysis, pulselessness, pallor, perishing cold. Causes for acute limb ischemia: thrombosis, rupture of a pre-existing atheroma, thromboembolism. Heart, AF, ventricular aneurysm, cardiac myopathy, aorta, aortic aneurysms, atherosclerosis in chronic limb ischemia. Claudication, stable disease, pain when walking. Critical limb ischemia, breast pain especially at night, tissue loss, non-healing ulcers and gangrene. Differential diagnosis of PAD: spinal canal claudication, osteoarthritis/musculoskeletal pain, peripheral neuropathy/neurogenic claudication, venous claudication. Investigations: imaging of arteries, duplex scan, conventional angiogram/digital subtraction angiogram, DSA, CT angiogram, Mr. angiogram. Check general condition: HB levels, glucose levels. Management of PAD. Control risk factors. Treat comorbidities. Exercise, foot care, drug treatment, antiplatelets, cilostazol/statins/iloprost, radiological interventions, surgical interventions.